Please follow these simple instructions when using the Aerobika OPEP device. Check that your resistance indicator is set as prescribed by your healthcare professional. Put the mouthpiece in your mouth, closing your lips around it, forming a good seal. Make sure your hand does not block the open circle at the far side of the device, opposite the mouthpiece. With your lips still sealed around the mouthpiece, inhale deeply. Hold your breath for 2 to 3 seconds before exhaling actively, but not forcefully through the device. Active exhalation should last 3 to 4 times longer than inhalation. Keep your cheeks flat and firm. For example, you should exhale with a firm, steady breath, similar to blowing up a balloon, rather than using a fast, forced breath, which is similar to blowing out candles. Continue taking deep breaths and long exhalations for 10 to 20 breaths, or as instructed by your healthcare professional. After which you will perform 2 to 3 huff coughs to clear your airways. To huff cough, sit up straight with chin tilted slightly and mouth open. Take a slow, deep breath to fill lungs about 3/4 full. Hold breath for 2 to 3 seconds. Exhale forcefully but slowly in a continuous exhalation to move mucus from the smaller to the larger airways where it can be coughed out. Continue with the Aerobika device and huff-cough cycle for 10 to 20 minutes, or again as prescribed by your healthcare professional. Treatment should be performed twice each day and increased to 3 to 4 times per day if you are producing a lot of mucus. Stop using the Aerobika device and contact your healthcare provider if you feel dizzy or lightheaded, or if you have any discomfort.